I think that a lot of the rest of the slide is really self-explanatory, but I think what's most important is that we are so wanting this research data to come to us that our office has created its own Ann Arbor Center for Independent Living Institute for Community-Based Participatory Action Research. Boy, what a mouthful, right? And that reasoning is because we want the action. We want to have it happen. We want to know about it. We want to do it. We want to be part of it. We want to be the creators of it. We want to be the partners in it. So often when we have in the past been involved in research studies, it's, can we use your office for a focus group? Okay, very nice to use my office as a focus group. What does that mean financially to me and my office? What does it mean financially to the participants who had to come? Maybe they take off work. Maybe they travel a long distance. I do agree that a lot of people who participate in research do it because they want to see that change and they want to see that improvement. But equality is not there at the moment. And I'll just give you a very simple example. The institution, we applied for and got $55 million for our study. When we work with a community group and they get a study that might be $25,000 for the study, and it's a primary, co-primary, one in the community and one part of the university, and if you only got even half of that money, it's $12,500, right? Because 25 if it's split between the two. But we're even getting less of that really out in the community. What we really need to do is figure out how to raise those dollars that come to the community to make this research sustainable. The elements that we see that are effective in partnership, we've heard a lot about these, but that mutual understanding of what the issues are and then the respect back and forth. That we as clinicians, as social workers, doctors, physical therapists, nurses, and I could keep going and going and going, need to have the knowledge. As Carolyn had mentioned, and as Patty earlier in her presentation mentioned, as professionals, we are not trained enough in what that means to be a person with disability, to be people facing stigma, to be people who have been oppressed for many, many, many generations. And so we need to raise that bar. That's one of those bars that I personally am working on raising. I get to teach one semester per year, and I get about 25 students. And sometimes I get to do guest lectures like I'm doing today. But that's not the 600 students that come to the School of Social Work. That's not the 25,000 students who seem to be on campus on a regular basis. That's not the 40,000 employees of the university. As you see, it grows. And if we said the 350,000 people in the community, and you keep going, you can see it gets broader and broader. And it's not that I'm the only one doing it either. I should stop at that as well. And then this piece of trust, this element that we really have to build that relationship and be a partner, be an equality partner. Equity is very, very important. And the other piece is negotiating what that's going to mean for a person so they really have an understanding so that they can commit and be jointly accountable for what then happens. We've talked about this co-management and implementation, that's the co-PI piece, and then sharing the celebration of the successes so that when we have that data, it's not the 2, 3, 4, 5 years later. It's that get that right back out to the community, what we've been talking about. Hold those celebrations. Help the people in the community who participated feel proud of what they gave to the success of that study for those that have been involved. And then the sustainability piece. What are your visions? What are the people's visions here in the room? What would be those values that would be important to you? What is important for you to continue to do the research that you're doing? Could some people just shout out what some of those might be? What are some of your values? Equity? Yeah, important. What else is a value that you have in doing health and community research? Optimizing, is that what you said? Humanizing, sorry, that was the word I didn't get. Yes, humanizing the experiences and the treatment and the respect to them when they're in the studies. Exactly. Helping that person feel like they are not just a number. When you're working with them, they are a person, a whole person, whatever it is that you are studying. Absolutely. Other values? Yeah. Learning from the community organization, and somebody else was saying something too? Community benefit. Yes, and one that I've already said, and I'll say again, is looking at those assets in our community. That we have so many people with valuable information who want to help make change, who want to help improve the quality of life of everybody in our community. Anybody else? I'll take one more if there's somebody else. Transparency, and what was the other one that came out at the same time? Transparency and sustainability. It's really important that what we do, they see, what they do can be used, and what they do can be maintained. Because if I, as a person who has diabetes, participate in an insulin pump study, which I did, and then I go along and I'm using it, and then I don't know what the benefits were or how it changed the community, then I'm not getting that same information back. Now, as you already heard, loud voice over here, me. Of course, when Dr. John Floyd was here and he was doing the pump study, he heard from me regularly. So how many people are in the study? What's happening? How am I doing? How am I comparing? But that's not what every participant's going to do. So we need to reach out to the other participants to make sure that they know what's going on. And that's part of both the transparency and sustainability. I really do see them both actually connected to each other. And so it's interesting that you both blurted those out at the same time. And I know that we have many other values, but we're going to run out of time if I keep going with them. So I'm going to move on. So here's your assignment. It is teamwork. We need to develop effective frameworks to collaborate, to do research, with you and the disability community. What that means is that equal partnership. Every time you work with a team member, whether it be the patient, the community, or the family, however it's going, that person's value on that team is critical, that they are the expert on the team, and that we help them by being a team builder to build their team to be stronger. And so that's really, really a thing that I think we need to hit home, is that when we include everybody in the process is better, the outcomes are better, the results carry forward, people feel stronger, more empowered, more capable of being part of those solutions. Others that you can reach out to, we've already heard it several times, is through the MICHR, the Community Engagement Council, all of the websites that we've been hearing about, and there's every day I think we get more and there's more connections. If I could just sit at my computer all day long, I'd probably have that computer syndrome that's going around, because there's so much information to gain, and we all only have so many hours per day, but just know that that resource is there. Our database is there with 3,500 people in it. Of course, we don't have 3,500 people who have kidney disease, and we don't have 3,500 people who have mental health, and 3,500 people who have diabetes. But from that 3,500, we probably have at least one or two or three or four, and they may know other people who have it, who we don't have in our database. Or our databases that we're sharing with communities wider may have it. And so, for example, that I'll just give you, the study that we replicated in 2007, we are currently in the process of replicating statewide. So the same questionnaire is now being used on the websites of all 15 Centers for Independent Living in the state. So we're looking at seeing how the impact of what we do is affecting the larger community, as an example. Right now we have 40 local support groups that we're directly connected with. I'm sure there's even more. We have so many nonprofit groups in our community. We have a rich wealth of organizations in Washtenaw. There's also a rich wealth of organizations in every community. We just have to help uncover them and make them be part of our teamwork. And that's part of where, if we had some funding that we could all find, that could be that early funding, not just for research, but early funding for uncovering where are those possibilities in our community, I think that we would be amazed at what's out there already. And then finally, on our local campuses, we are rich with communities with colleges. Here, just in Washtenaw, we have 4 institutions. In Wayne County, they have 2 or 3 institutions. In Lansing, they have 2 or 3 institutions. We have folks all over the place who are going to school. A lot of times what has happened is that we forget that pre-IDEA, which was the Education Act that allowed people with disabilities to get services, students were not being put through school completely. Many did not graduate from high school. Now we are seeing an upsurgence. Thankfully, people are getting the education. They're graduating high school. They're now in our colleges needing services that are not the same as what you get from IDEA, which is the K-12, kindergarten through 12th grade education, but what they need as adults to be translation and participating as adults in our community. But if we go to our Services for Students with Disabilities office, while they can't give us the names, just like the doctors can't give us the names, what they can do is put it out there that we are looking for such and such, and then pull from that pool. Many people participate in all different kinds of little areas that we can find more people. What I see that we need, and this was also published in, I'm forgetting, it's in my references, I'm forgetting at the moment because it seems like I didn't put it on here, is that we need to create the universal health care and research environment, and I'm reading this directly because it's really important, and services that benefit all of our patients and subjects, including the patients with disabilities. The knowledge of existing codes and standards serve as a starting point. It really is the beginning in meeting accessibility guidelines. By doing so, we're going to go above and beyond the accessibility required as a partnership between us and the partners of people with disabilities. We are able to do more than what we do, and when we do that, the goals benefit everyone. As an example from the outside world, if we look at curb ramps, and when we look at curb ramps, they benefited people with disabilities. They benefit people walking to not trip. They benefit people who use strollers. They benefit people who are carting services in and out. They benefit people who use wheelchairs. It affects everybody. And so when we see that, when the people with disabilities are included, we can really make a difference. For more information, please look at the ADA accessibility design guides, because when you do a program, your program, that's your research program, should be fully accessible to every participant. And that's why you heard me yesterday asking the presenter if those websites that they're creating are accessible. Because if you're a person who is blind or who has a cognitive impairment or who has mobility issues, will you be able to navigate what has been set up? Because the information he has is wonderful. We want to get that out to everybody. Here's a list of some of the references and partnership. As an example, one partnership I didn't get in here is that we've been partners with the University of Michigan Spinal Cord Injury Program for 25 years. We've been partners with the School of Social Work for about 10 years. So there's different partnerships that have spurred up in different places, and we just want to keep those going across the way. We've done a National Library Science research project with the Taubman Libraries, Health Libraries. We've been involved with the pathology department. There's just different departments. We welcome all of you to get involved with the disability community, and I'm sure there's more than I even know about that you could share with me back. I really thank everybody for their time, and I hope that the community connections continue to build. Please feel free to contact me at my email or by phone, and I will do my very best to connect you to where you need to go if I'm not your proper resource. And I'd like to open it up for Carolyn to ask you to share any questions that anybody has.
Let me just first
Thank you.